Hi, everyone. I'm Ashley Wendell, and this is Lead Well MD, a podcast that explores how leaders can transform healthcare through emotionally intelligent, effective clinician leadership.
So I am very happy to be talking with someone who really does know what it means to lead when every second counts. My guest today is Dr. Tony Briningstool, the ER physician and now the CEO of emergency medicine at Sound Physicians. And we're talking about building trust in high-stakes environments and what it takes to create that psychological safety in the middle of chaos and how leaders can really regulate themselves to be that steady hand when their teams need it the most. Welcome, Tony. Thank you so much for being here.
Oh, thank you, Ashley. It's a joy and a privilege to be with you today.
Thank you. Thank you. Well, I thought I'd share a couple of things about your background. You did your MD at Georgetown, and then you worked in the trenches as an ER doc for about 8 years before you started taking on leadership roles, right? So executive medical director, chief medical officer, senior VP and CMO, and now finally CEO of emergency medicine for Sound. It's kind of an interesting journey, I would say.
Yes, very enjoyable one.
So this show called The Pitt has been out there. I wanted to get your take on it and what you thought about it. What was your first reaction when you saw it in terms of just somebody who knows this world so well?
That's a great question. And as you said, as a practicing emergency medicine physician and having worked a large part of my career in a level 1 trauma center for both adult and pediatric patients and really seeing the volume and acuity that environment brings,
Yeah.
I really enjoyed The Pit. I thought it was a really well done show. And I think what it did a great job of is really showing what the emotional burden that healthcare providers on the front line carry. And I think when you think about that show and you think about the different cases that the team was experiencing, all of them are high energy, high tension, but high stakes cases that kind of tie into some of the things we'll talk about. And not only does the skill and expertise that's needed to deliver the right care for each patient in the right time when it's time sensitive, but organizing the team around that. But what the show did a great job of is not only showing that skill, but that skill coupled with now the emotional burden that those individual cases carry.
Right.
And I think the part that the show did a really good job of, but that I think sometimes gets lost is what healthcare providers or caregivers do who are practicing in the emergency department or on the front lines, caring for patient after patient after patient after patient. And each one of those rooms is someone who wants them to be to get your undivided attention. But what they don't understand is what's happening outside of that room in every other room that you go into, and you carry that, all the emotion and thought and careful consideration of and even what those social situations might carry, as the show did a great job of showing, and how we as caregivers and particularly emergency medicine physicians and nurses and frontline caregivers, how we manage that and how to manage that successfully. Because in the end of the day, we take each one of those patient scenarios to heart and we carry that with us room to room to room. I think some really successful caregivers are able to process that quickly and are able to hit reset before they walk into the next room and see their next patient and be able to be present for that patient. But the show, to your question, did a really good job of showing what that secondary burden is that really just comes with the care and compassion of delivering our specialty in a thoughtful way.
Well, and what I love too is that even the ones who do it well have a point where, it can break. And I think being kind to them, being kind to ourselves, the people who are in it, I think I thought that was an incredible change from other shows in the past that have shown emergency medicine. It was such a realistic portrayal of the humanity of it. And I mean, in my perspective, and of course, I'm an outsider on this, but do you think that it's helped public perception about what actually goes on?
Boy, I sure like to think it helps. I hope it really creates perspective. And I think with perspective comes better understanding because frontline caregivers are just trying to do their very best to be as thoughtful and skilled and compassionate in each and every encounter that we can. But we're human and we're humans taking care of patients. And in that, everybody's going to manage it a little bit differently. And you don't understand necessarily where everybody's starting point is. And so what their reserve, what the resiliency level is, what their capacity is, what their ability to cope and equip that or manage themselves in some of those stressful environments. All of there is a variable that can come into play. And so I really love the question you asked, because I think if everybody saw the Pitt, I got to believe that most people would walk away from that feeling incredibly appreciative of emergency medicine physicians, caregivers, advanced practice providers, nurses, and recognizing how important they are to the fabric of the healthcare system. And maybe having a little empathy for the caregiver, because everyone shows up every day to give their very best to others and help them through their time of crisis.
Right.
But it doesn't make them immune to absorbing the energy that comes by managing that case.
That's right. Gosh, yeah. Yeah, and I think you're right. That's what people, I think, forget so often. And that's what I loved about that show so much. They brought that to bear, that humanity to bear.
Another cool thing that the show would show, which I think will tell you, and it's sort of what is emergency medicine's the ultimate team game.
And well,
And so
right. Yeah.
if you watch, having played college football, we can talk about that a little bit, and some of my mentors who've influenced me along the way. But if you looked at the show, I thought not only did it show what I just described about the incredible emotional burden that comes with being a frontline caregiver, and the joys and the sorrows that come with that, but also it is an incredible team game. And you see
Yes.
that good healthcare is team driven. Good healthcare is coordinated and collaborative. And we put our patients at the center of what we do. And we as physicians can lead the team thoughtfully to
Right.
ignite that caregiver experience
Right.
for our patients. I think it really does help make sure that they get the best of we can all.
Yeah. In fact, I thought that was one of the best things about that show, is showing the complementary value of everybody in that group. Everybody, right?
Everybody has a role.
That's
So
true.
you say this often, but everyone on the team has equal value, but a different responsibility.
Right.
And it's important to recognize that all members of the team are vitally important to the success of the care of a patient. And being a team first physician, a team first leader, it's not surprising that I chose emergency medicine as my specialty.
Right. Right. Well, let's talk a little bit about that. So, what do you think, from all of the years that you spent at the bedside, what do you think most shaped your views on how you lead now, in the role you're in now?
That's a great question. And I think I would even go back to before I was leading or caring at the bedside, the
Wow.
influences I had and really did help shape me. So if I can, I'll just go all the way back to the very beginning. So, and share with you sort of some mentors who are near and dear to my development, not only as a physician leader, but certainly as an emergency medicine caregiver. So I grew up in Northville, Michigan, which is just outside of Detroit. I knew I wanted to be a doctor from a young age, and I didn't know what kind of doctor. I just wanted to help people, and I really was the whole idea of healthcare and medicine. Didn't really know what that meant, but I just wanted to. And so I had the privilege to play college football. And so when I was coming through the recruitment process when I graduated from high school in 1987, several colleges had recruited me to play and knew I wanted to do pre-med. But there was one college and a couple of coaches in particular that really embraced this. And I was at Michigan State University. And you might know Coach Nick Saban, but Nick Saban way back then was the defensive coordinator at Michigan State. And Coach George Perles was my head coach. And I remember I was 17 years old. I showed up for my official visit there, and it made such an impact on me what Coach Saban said. He said, "Tony, before we ever talk about football, we're going to talk about medicine. You want to be a doctor? So I've arranged for you to go to dinner tonight with a physician in the community who was interested in meeting with a potential recruit. And you guys can go talk medicine, and then we'll talk football." But that made such an impact on me. Well, physician he introduced me to was named Dr. Michael Clark. And Michael is a dear friend of mine and then just an incredible mentor. And Michael was the first board certified residency trained emergency medicine physician in the state of Michigan at that time. He was the first residency graduate. And lo and behold, it was divine intervention, but God had steered Michael into my life. And so I met Michael. So here I am now coming home from my visit there, and every other school I looked at wasn't near as committed to my pursuits. But so I chose Michigan State. Well, the reason that's important is that I had the benefits of Coach Saban and Coach Perles teaching me leadership from the football perspective. And I had the benefit of knowing Michael and spending time with him, who was a Georgetown grad. So that's why I went to Georgetown. Then I came back and did my residency there in that program at Sparrow Hospital at Michigan State University. and then worked with Michael in my attendingship. So when I think about the lessons that they taught me or invested in me at a very early age, it did shape the direction that I went. And then we became emergency medicine physician because of Michael's influence, and then worked alongside him for many years at Spiro before then moving into larger leadership roles so I could invest in our specialty and in different ways.
Wow, that's quite a story. I mean, really. So what do you think was, what did you carry from them the most? What was the biggest lesson that they taught you? I'm sure there were many, but
There are so many, and but I think I'll give you one.
okay.
Um, I'll use Coach Saban first, and then I'll give you one from Dr. Clark. But so obviously, you look at Coach Saban's history and what an amazing coach he is, but developer of young men. And I love this. He instilled this in me very early on. He said, to be excellent, you have to be focused on the process of excellence. So excellence is not just like a metric or a number or a result,
Right.
but it's a behavior, it's a discipline, it's an approach, it's a way that we attack our everyday and the elements of every day. And it's really building the process of success will drive success. And I carry that in every single team I work with, every single hospital, every community we serve, each patient we care for. I work with our teams to focus in on the process of excellence will drive the right outcome for our patients. And so that really has stuck with me for so many years. And then when I think about Michael, if you got a chance to meet him, he's just an amazing, highly compassionate, highly skilled, and just a people-focused person, a people-focused leader. And in all of his elements, how did we meet? Because he was looking to say he was people-focused. And he said, sure, happy to meet with Tony.
Yeah.
Who would have known that would turn into a 40-year relationship that we've had, and he would have such an influence on me. But I watched how he treated patients, and I watched how he cared, and he brought empathy and thoughtfulness and compassion to every patient experience. And when I watched him do that in the emergency department, it shaped me. Well, I've carried that with me forward. And so, here in my leadership roles, we always talk about our patient-first culture, our patient-centric focus. And for Michael, because I watched him do it patient after patient after patient after patient, no matter what the circumstances of the care was or the reason for being in the emergency department, thoughtful compassion and empathy to every bed to the best patient.
Can I ask you, how did he, and I'm sure he did, how did he take that to his peers, to his colleagues?
Yeah. So I think leading by example is so infectious. And largely to your point about building relationships and being effective as a leader in high stakes arenas, emergency medicine being one of those, trustworthiness is critical to that. Your team has to look at you and see what you're asking of them to do modeled. And so as we model the right behaviors and as we are bring an element of consistency to our leadership, it builds trust. And as it builds trust, and then when they see the leader serving the team, meaning I'm doing what I'm asking you to do, or I'm modeling for you what excellence looks like, then it really is infectious and people align around that. And that's really where consistency and alignment comes from. But I think one of Michael's strengths was really his ability to lead by example.
To lead by example. Yeah. The next question I wanted to ask you was about trust in particular, because if you're functioning in an environment where trust has to be built in seconds in those very high stakes arenas, right? So you just said two things that really struck me. If you're looking at how you do that in practice when you're really shoulder to shoulder with people, consistency and modeling. So it's about those moment to moment behaviors is what it sounds like. But tell me more about that, about trust building in those high intense environments.
Well, that's a great question. And can I take it from two different perspectives? Because I think one is building trust with our patients who we're caring for. In emergency medicine, we do that in moments, in seconds. It is measurable in the either you do or you either did or you didn't. Yeah. And I think there's an importance of that. And then there's obviously trust within the team. And how does the team trust the leader of the team to really perform at their very best in and around the patient, as we talked about before? So I'll just give you examples in both.
Please.
So in emergency medicine, patients didn't plan to come see us today. Something unexpected has happened. When they come into the emergency department, there's a problem that brought them there. Chest pain, abdominal pain, trauma, whatever it is. But there's some situation But with that situation comes fear and anxiety, this emotional burden that's coupled with that. And so I think as an emergency medicine physician, or what I teach our teams to be mindful of, is recognize when you walk in the room, it's not about anything that I bring. It's not what I bring that's in of my own. It's what
Right.
can I bring to meet our patients where they are? How do I meet them where they are? And how do I connect? And it's from your introduction to a warm shake of their hand or an acknowledgement, to good eye contact, and to thoughtful questions that we answer. And what we do in the very first moments of that encounter is going to determine whether a patient trusts you or not. And when they trust you because they know that you're here to help them through their time of need, or you're going to connect and be thoughtful and compassionate, you're going to listen, you're going to do different things that are going to help them be able to communicate where they're at and what's happening so that we can align or design the right treatment plan. That, of course, is encompassed in a trust relationship. And that
Mhm.
trust is verbal, it's nonverbal, it's thoughtful,
Right.
you have to be intentional as a caregiver when you come into the room. I can't come into the room and stand in the doorway. I can't come into the room and have something else distracting me. I'm having a bad day because of something else affecting that
Right.
encounter. We
Yeah.
just got to be thoughtful and meet our patients where they are and be thoughtful in our approach to them. And when that trust is almost immediate. Patients want to trust you. Give them a reason not to trust you. Does that
Right.
make sense?
Yeah, you'll get better information. You'll get more, you get truthfulness. There's so much benefit to you as well, right?
Uh, you'll get honesty, you'll get better
Yeah.
information, you'll get a more thoughtful, response. And then what we're able to do is then they give you permission to communicate. Now we can communicate more effectively. What's our plan of care? What's my impression? What's the team going to do to help them?
Right.
And I think just going back to the Pitt for a moment, you saw great examples of where connection when trust was made and where
Yes.
connection and trust wasn't made. And you can see the results of either one of those. I think, that's an important piece we think about from a patient perspective. And then we think about from the team perspective, we talked about leading by example, but also in that environment, you have to bring a confident level of execution, but the warmth and openness to the team, which is where trust within the team comes from. And I think the show did a good job of showing that. So in a high tense resuscitation, when there was effective communication and the thoughtfulness of what we were doing, and if you align the team on the goal, then the team performed much better. Then when you probably saw times in the show where there was bickering or snide comments or condescending attitudes or different things like that, that doesn't breed confidence and trust, doesn't unite the team, and then there's breakdowns, right?
Yeah.
And so I thought, just using the show as an example or an anchor point, I thought it did a good job of showing what are the strategies of building good trust in tense environments that can really align the team on the best outcomes, or at least aligning the team on providing the best care to get to the right outcome, and
Right.
where those breakdowns get in the way of us really being our best.
And I also thought they did a great job showing the leader having a lot of humility, which was a positive, but also keeping track and staying on top of those breakdowns when they were occurring and not letting that stuff go necessarily, right? I thought they did a great job with that as well, because maintaining that tone, I think, also is a big key factor in maintaining trust on that team.
100% agree. And that actually made me think of one other word I would use too. And I think as leaders, it's okay to be vulnerable, and it's okay to be open with the team that you're leading. And I mean that in a way that if you think about the struggle that I'll call him, Noah so we all know we're talking.
Robert, yeah.
Yeah, but anyway, when you think about his vulnerabilities, his mentor was dying of COVID,
Right.
and he couldn't save him, and he had to make a decision about, I finally have to take you off the vent because another patient needs the vent, and this is an insurvivable moment, right? But the pain of that decision and what that meant, but his vulnerability to really being able to share that with others and allow others to see that in him, I think
Yeah.
created trust where people felt,
Yeah.
hey, you're human. Hey, I can trust. I know where you're at emotionally, but I know where you're going to lead us to. And so I only use the deep analogy of the show to say I thought it did a really good job of accurately portraying some of those elements that come into how we build trust with our teams.
100%. I think the hard thing, and a lot of people struggle that I know of with that vulnerability factor. That's a tough one,
Yeah.
right? For a lot of leaders and just for a lot of people in general. But I think, I did a podcast episode with Greg Johnson, and we talked about vulnerability.
Great guy.
Right, Greg? He did a great job, and he was uncomfortable. So yet he even owned that he was uncomfortable talking about vulnerability, but he did it. He showed up and he did it. But, we talk about the fact, and so many people have listened to that episode because I think it hits a nerve that people want to figure out, how can I show my vulnerability in a way that I'm not overdoing it, but that I am still building trust with people around me. It's a tough one. So how do you do it? Or how do you maybe coach your leaders on that? Because that's a tough one.
It is. And I think coaching to it is, there's no single recipe that says, if you do these things, then you'll help a leader get to the right outcome. I think experienced leaders, and when I think about it, I look at, much like we talked about in meeting our patients where they are, I think we meet people, our leaders, where they are. And everybody has a different combination or blend of strengths and weaknesses, and recognizing what those are. And then with the understanding that, as your mentor, as your leader, as your colleague, my goal is to help facilitate your success. My goal is to help facilitate your progression so that you can have a greater influence in the things that you're doing with the people you're entrusted to lead or the patients you're entrusted to serve. So when I think about it from my perspective, I look at it as, how do I help move them along? How do I help facilitate or enable them to be more comfortable, to be more connected, to be more intentional? And so it's not like a single recipe fits every single person or scenario, but it's recognizing that, hey, we can do this together. We all can progress. I just want to bring in a level of intentionality to meeting them where they are, and then helping maybe see where I can encourage or advise or guide to support them in helping them progress.
I always say to people that I'm working with, coaching or teaching, where sometimes just being aware when you haven't done it right is a growth step, right? It's cutting themselves some slack to realize that they're never going to be able to dive into this with both feet perfectly. That even the process of starting to recognize when they didn't do it the way they wanted to after the fact, that's a growth step. That's part of the intentionality process, right? Yeah, giving themselves some grace around that, because it is a process.
It is.
Yeah.
We're always, as you know, you do an amazing job of this, of coaching and supporting leaders, but I think we're all evolving, and we should all be growing and learning every day. And we have the benefit of others who've invested in us, who've helped us move along, and now we get the joy of investing in others. But it's all about helping people maximize their influence.
Yeah. Well, on to that point then, the other question I have around trust is, sometimes it's helpful to just think about what specific behaviors are we talking about. So for you, for example, what do you consider the highest trust behaviors that you would want people to demonstrate when they're in those environments, those high stakes environments? Kind of, what are your non-negotiables around building trust in that space?
Oh, that's a great question. And I'll tell you what comes top of mind.
Yes.
Consistency is incredibly important. The team around you has to know that who shows up every day is the same person. So I think particularly in situations where in emergency department where we're working to do things, consistency is incredibly important. Thoughtfulness. Yeah. Our approach needs to be, for my mindset, it's always about our patients, and it's always about the mission of meeting them where they are and helping them through their time of crisis in a thoughtful and compassionate way. And I think that our team, if being consistent day in and day out and being thoughtful, or keeping the main thing, so to speak, and not letting distractions get in the way of that, is in two incredibly powerful ways that we can build trust within our teams. And then I think if we go beyond that, it's modeling the behaviors we would ask others to do. So leading by example, I think is great. So it's not just what happens in the resuscitation room, but what happens in the hallway, what happens between rooms, what happens at the beginning of a shift or off shift. And so I think those are all ways that we work within the team to reveal ourselves in a way that there's trustworthiness there that helps happen. And I think the other one that comes to mind is vulnerability. We talked about that, but a leader who endears themselves to others and takes time to build relationships and is willing to recognize that I don't know it all. We know a lot. We have a lot of experience, but I don't approach any situation as if I have all the answers.
Right.
We approach it with a level of healthy confidence, thoughtfulness, consistency that I think allows, and vulnerability, which allows us then to connect with people. And when
Yes.
the team feels they can connect with you as a leader, they'll follow you. And I think that's get the best outcomes.
Yes, that's a great point. And it the point I was thinking about as you're saying that is that balance that people struggle to find between having the authority, especially if you're the one in the lead in the room, right? Having that authority and making those critical calls, but then balancing that with what endears people to want to follow you, right? But it's a balance that people struggle with, I think.
Yeah.
Right?
Well, there's a security there or an insecurity there that can sometimes get in the way. And
Yeah.
there's and then there's a fear that if I don't know all the answers, then does that discredit the answers that I do
Yeah.
know? And I think that some of that just comes with maturity. I think I probably earlier in my leadership was probably worried about, do I know enough to be able to lead others? Do I have enough influence? But I think as we invest in others and continue to thoughtfully show up every day in a consistent way, I think
Right.
we learn over time and we all evolve and progress. And I think what that does is teaches us that you don't have to know it all.
That's
You just have to be I think we just have to be willing to say, what's the goal? And
Yeah.
the goal here is bringing a team along to achieve the outcome, right? And
Yeah.
think back to what, Coach Saban had shared,
Yes.
the process of being excellent that drives excellence. And so I think as leaders, don't be so concerned about knowing everything, but be focused on what the process is of supporting your team, loving your team, caring for your team, guiding them in the right direction, making sure they have what they need. And as you model that, trust will follow.
Yeah, that's right. That's right. And it speaks to what we were talking about a few minutes ago about the complementary nature of the teams,
Over.
like in the show, right? Bringing out the best of the people in that room, knowing how to do that, right?
Right.
Lends to the credibility and the authority right there.
Actually, can I throw one other thought in there? Just
Yeah,
back in,
please.
but you were talking, well, I was listening to what you were saying, and I thought the show did a good job of this too. But when we manage others up, it also is when we recognize the successes in others and we celebrate that,
Yeah.
it gives them confidence to know that they're moving in the right direction. And I thought to what you were saying and what the show did a good job of is, I think healthy leadership is recognizing the talent strengths within the team and then celebrating where you see wins happening,
Yep.
big or small, so the team feels confident in what they're doing. So think about a resuscitation in the room, making rapid decisions, looking for feedback of information, taking the information, assimilating it, making other decisions. But when you see the team starting to make that decision in advance of your decision, that you can recognize, yes, that's the right direction to go, or you did a good job with that, or I really like the way that you thought through that problem and came to this solution. And that's just a singular example, but it's an idea of ways that we take the talent in those around us and celebrate
right.
that, which
Yeah.
then helps then
Yeah.
fuel that forward.
They did a great job in that in the show. I
Mhm.
loved actually how so often Robbie would come and he'd sit in the back of the room and on the side and he'd kind of listen and watch and see what's going on and just, jump in if he had to, but he often didn't and just,
Let's keep
do
it.
a job and move on, right? I mean, I love the term that you're saying, the process of excellence. That's all part of it to me, right?
Mhm.
That process, building that process. So let's do a little segue into, I think, one of the big supporters of that process, which is this idea of psychological safety,
Mhm.
right? And I'm imagining, I mean, certainly in any critical environment, it is foundational, it's paramount. But what would you see if you felt that a team was lacking that? If you were a fly on a wall and were noticing that a team was not feeling psychologically safe in that space with their leader, what would you see?
Well, I think what you would see right away is barriers to effective communication.
Okay.
So people withholding, people on edge or on guard, or when there's a lack of trust for the reasons that you described, when someone
Mhm.
feels psychologically unsafe or uncertain, maybe it's
Yep.
uncertain is that gray zone in there,
Mhm.
and they're going to be more withdrawn, more reserved, less comfortable.
Yeah.
And when you see teams that are performing that way, where there's some barriers or rigidity in the way that in the fluidity of how they're working together,
Right.
to me, that uncovers an underlying problem that needs to be addressed.
Right.
So whether it's in a crisis situation there, or just whether it's in the normal dynamics of a function of a team, I think as leaders, we need to be mindful of always being open-minded
Right.
and not just assuming that it's not there, but being open-minded to check and validate that it's not there, so that we can make sure that if there's any hint of, it's not like it is or it isn't, it's a gray zone. And so we want to make sure that if someone has some tendencies where they feel uncertain or untrusting in certain areas, other members of the team, I think it's up to us as leaders to really vet that out.
Yeah.
It's not always a bad thing. It just could be an opportunity to strengthen the team. It could be an opportunity to speak to maybe a misunderstanding or a misconception that allows us to further invest in the team and strengthen them.
I agree. I think the big thing is we can't make the assumption that if we feel psychologically safe in that room, that everybody does.
That's
Right.
right.
And sometimes that's why I think it's useful to really think about what would some of the signs be if somebody's not speaking up, because we don't know what's going on underneath, what's causing the uncertainty or the lack of safety. It could be a million things. They're new to the team, or, their English is not their first language, or it could be so many things that could cause that. So the question is, what do we need to be looking for, right, as leaders? And then what do you think are the biggest barriers to safety in that kind of environment when things are really high stakes? What do you think gets in the way the most that leaders need to watch out for?
That's a great question. I would say the fluidity of how the team communicates, both verbal and nonverbal, is a great clue to the safety of the connection people feel, right? So as experienced leaders, we watch teams. It's not just what the team says, but what does the team do? Sometimes they say the right words, but behave. You can tell that there's a tension, or you can tell there's something in their nonverbal language that is a clue that things aren't as rosy as it sounds, right?
Yeah.
And so I think it's just looking at the fluidity and performance of the team, and what their verbal and nonverbal cues are. And a thoughtful leader will pick up on that and then take that and say, okay, I need to explore this a little further. But then in exploring it further, it needs to be done in an open-ended, thoughtful, safe way, right? So, I noticed this. Can you tell me what you were feeling at the time? Or can you tell me, is there something here I should be aware of that is a barrier to our team success, or whatever words we choose to use, but you get the idea. It's speaking to the observation, and the observation being revealing maybe a breakdown. And if we're thoughtful as leaders and are willing to do that, we can really strengthen the performance of our team. And sometimes it's like we said before, sometimes it's a misunderstanding. Sometimes it's a mischaracterization or a misconception. And sometimes there is something there that we need to just correct because somebody else did something maybe unintentionally, but it helped someone else feel a certain way, and or struck an emotion, and then we just got to manage it. So I look at all areas as just team building and team management, but it's really all about, again, the process of excellence is focusing on people, meeting people where they are, looking at how we equip and support them, making sure that they're in a collaborative, cohesive environment that's focused on the right outcomes. And then with that, we'll be able to move the team forward.
Right. Well, and I love that you say focus on the observation of what you saw versus your own interpretation. I think that's my thought is stay away from interpreting what you saw and instead just focus on what you saw. And I love there's a saying that says, don't believe everything you think, because it's, we're so often wrong.
It's right.
So going in with that more open mind. Well, I just want to shift a little bit into this idea of self-regulation, because it is so, so important for leaders. In that environment, as the lead, you're expected to be calm under pressure, right? I mean, that is the expectation I would imagine is put upon you when you're leading teams in those high stakes environments. But it's not easy, I would imagine too. So how do you regulate yourself when you're in that circumstance?
So I keep coming back to maybe some of these basic principles, but I think it's keeping your focus on what's most important, and that's the outcome for our patients, right? And in my situation, right? So if we are in the emergency department and we're focused on delivering care, we're in a team-oriented but highly focused environment, and I'm the leader of the team, as the physician there at the bedside, it's important to make sure that we keep the focus, keep distractions at a minimum, and keep the team focused on what we're striving to accomplish.
Okay.
I think that that is really important. When you think about how we self-regulate in that is, I think as we approach each patient encounter, it's just making sure that we are laser focused on what the mission is and keeping the team focused on the mission and keeping distractions at bay.
Right.
The thing I think is really important along that is back to the vulnerability thing. Like the team will respond to open questions. The team will respond to clarity and direction, even though we're not certain. There's a lot of things we manage where we don't know the cause of what it is. So
No.
the show did a good job of showing, you know, think about the guy that came in with an acute toxicity and he's blue and hypoxic and, experienced emergency medicine providers would recognize it. Well, it looks like that person probably got methemoglobinemia, but you can't go in the room and say, oh, this is a case of methemoglobinemia. You got to come from there. But the point is you rally the team around and we ask some questions. What do we think this is? Do you have an idea what this could be? Is there something we missed in the history? But giving people permission to contribute. If I'm the leader, if I give the team permission to contribute, then people around feel comfortable that they can share their thoughts. May be right, may not be right, but collective thoughts with a leader leading with focus on the outcome, I think is going to ensure that there's no barriers to communication. There's nothing that was helpful that wasn't shared. And we're all aligned in trying to be focused on getting to the best outcome possible for the situation in front of us. And then if I can throw one other thought in there too, I think is this one is think back to, we have a tank that needs to be filled too. So caregivers have to take care of caregivers.
Yes.
And I'm thankful for my wife, for my family, for friends and colleagues, for everybody who helps replenish our emotional energy so that we can continue to give it day in and day out for our teams, for our patients, for specialty, for what we do. And I think all caregivers, where they might run into challenges if they isolate, if they separate, if they aren't a part of a team, if they don't allow themselves to plug in, then it's really hard for them to be fueled. And when they're not fueled, it's hard for them to transfer that level of empathy and compassion at the bedside.
Yeah. Boy, Tony, it's interesting what you just said as you were sharing earlier about kind of coming together in the collaborative. It made me think it's almost like it's less about self-regulation, more about co-regulation with group, right? And so maybe it sounds like what you're saying with if you stay isolated from that, you drain yourself a lot faster than if you allow yourself to open up to the collective.
Right.
In that regard, in the trauma bay and outside of it as well, it sounds like. Yeah. Well,
Agreed.
that's really something. Do you think this is something that you've learned and grown with as you've gotten older? Is it something that you had when you were younger or learned from your coaches, or is it a process of learning?
I think it's a process of learning. I'm thankful to everyone who's invested in my development and invested in me over many years. But I also think for all of us as leaders, there has to be an awareness to what the team is, where the team is. And I think I keep coming back to meeting our patients where they are, meeting our teams where they are, meeting our leaders where they are. And I think when we do that, we're just more mindful of what the continuum of leadership looks like and more mindful of what the skills, as skills progress and enhance and then they play out the successes that drives for that individual leader. And then we get to celebrate that and it fuels more progression. So I don't look at leadership as a destination, just like I don't look like excellence as a destination. I think it's a journey. And as we sort of define it and get closer to what we defined, we redefine it and we keep chasing it. So, I just think that's the beauty of being able to be in a leadership role, to be able to serve others, to be able to help facilitate their success, maximizing their influence. It just comes from experience, understanding, and I think a willingness to recognize where opportunity lies and how we help others succeed.
Yeah. Well, let's end on this question. If you have a brand new early career ED doc sitting in front of you, what do you think is your biggest piece of advice to that person to do this well?
That's a great question. So I would say healthcare needs you.
Yes.
Your patients need you.
Yes.
Your team needs you. So focus on bringing your skills, your talent, what you've developed in your training. Meet your patients where they are. Bring that skill to the bedside. But bring your heart. bring compassion, bring empathy, bring the humanity side of it with it too. It's not, our patients don't just want a scientist in the room. They want a caregiver in the room. And a caregiver is bringing the right level of understanding with the right level of compassion. And when you bring that, it will fill your and just as much as you provide good to others. So I think that, to your point, we wrap it a lot of concepts in that, but I think where physicians and caregivers, where they get lost is they forget the importance of bringing the skill with the humanity or with the compassion.
Yeah.
And then, to your point, they isolate themselves. They get on an island. And when you're on an island and isolated, then you're going to run dry. And when you run dry, you burn out. And when you burn out, you're lost. And now you've missed out on a wonderful career, but healthcare has missed out on you. And so we've got to make sure that you're in it for the long haul, that we build good habits that recognize that practicing medicine's a marathon, not a sprint. But there's joy in every day. And we want to make sure that we help our teams understand that, because it's easy to get lost in the pressures of the shift, of the EMR, of the challenge, all of that, the dysfunction of healthcare, all that can be overwhelming. But if they're part of a team and they're plugged in, they keep our patients and they're meeting our patients where they are, I think it'll give them the right perspective to be able to have a joy-filled and very rich career.
Tony, do you think this is a cultural shift that is happening in medicine? I mean, I know it's slow, but do you think that there is more of that humanity being built in now than there used to be?
We're certainly trying. I hope to. I think about everybody
so
that I
true.
work with. I feel like it's the piece that was missing, for a long time, and I think our patients know that. And I think what healthcare needs is, it needs more compassion, more empathy, more thoughtfulness, along with the skill and science. And when we bring that together to the bedside for our patients,
Yeah.
we all win. And I think that, to anybody who's going into medicine or thinking about a career in emergency medicine, we need as many of you as possible, because it takes all of us to care for patients. But I hope that my thoughts and my guidance are helpful for others. And again, Ashley, really appreciate the time we've had together. Thank you for thinking of me to be on your show.
Tony, I'm so grateful that you've been here, and I really appreciate all the insight and the words. And I think just listening to you is going to help a lot of people.
It's good. My privilege and my pleasure.
All right. Well, we'll talk again soon, Tony.
Thank you, my friend. Appreciate it.
Bye. That's it for today's conversation. Thanks for listening, and great thanks to Dr. Tony Briningstool for sharing his wisdom with us. If this episode sparked new ideas for you on how to lead and support your teams, I would love for you to share it with a colleague. Remember, leadership in healthcare isn't about having all the answers. It's about creating the conditions where people and patients can thrive. Thanks for listening, and I'll see you next time.